All right, guys, something that comes up a lot with my clients is dry needling. I send clients to dry needling with a physical therapist all the time. I think it is a highly effective therapy, and it's just very worthwhile. It is not acupuncture, even though the two modalities use the same tool, this little acupuncture needle. It's really more like a wire. You don't even have to alcohol swab with these because it's not a hypodermic. It actually doesn't cut the skin. What it does is it's so sharp it moves the cells to the side and it goes between the cells. Now, a hypodermic needle that's hollow has a like a cutting edge to it that's meant to puncture the skin to inject fluids in the skin, sub-Q or intravenous. So, same tool but different mindset between the Eastern medical practice of acupuncture versus the Western medical practice of dry needling. And the technique is different as well, where an acupuncturist is going to more likely to leave the needles in place and use several needles at the same time. They are affecting meridians and chi. They're going to insert the needles along meridian lines and to get the chi moving in your body, and that is their modality. Versus a Western practitioner like a doctor of physical therapy, a athletic trainer, or even a more Western acupuncturist is going to use a technique more like dry needling, where they're going to put the needle in and just kind of stab it around. They call it pistoning, and they're going to work in trigger points that are more physiologically known. It's just a little bit more scientific versus the more chi-centered medical practice. So they're both medical practices, to each his own, whatever you think is more effective. I tend to send people more to dry needling. I have a physical therapist that I work with locally that I send people to. I think it's a highly effective therapy. I think it is about 5 times as effective as massage at getting at one thing and one thing only, which is getting a muscle to release. I was personally sent to dry needling by my massage therapist. She was like, "Josh, I can't get anywhere into your back. This is too rough. You have to go get dry needled before I can even get anywhere." And very effective therapy. The muscles will twitch and spasm. And so if a muscle is happy and healthy and you put a needle into it, nothing happens. And most people can't even tell the needle is in there. It's so benign. But if the tissue is too tight or sick or unhappy, it is going to twitch and spasm. And the more sick it is, the more it's going to twitch. And I remember my triceps. We were doing my triceps, and it looked like I was throwing punches. My tricep was just jumping every time the needle hit it. So it was a lot of fun, and it was pretty painful too. And in that respect, I kind of tell people, if it's really painful, the more it hurts, the more you need it. Now, about 20% of the population doesn't like needles, and about 10% of the population has an absolute phobia of needles. So it's not the right therapy for everyone, but it's very safe and effective if you can find a good local practitioner. So hope that clears up the difference between dry needling and acupuncture. If you have any more questions, fitbodywork.com, where you can book with me, and I also do online consultations. So thank you. Bye.